Welcome to Kids Covery, dear doctors. Myself, Dr. Parv, and we are discussing pediatrics. So this video will start with a small case study discussion. So this is a case study of a 8-week-old child having constipation, having weak cry, hypotonia, as well as respiratory distress. Okay. So can you see there is a respiratory problem, there is a constipation problem. Okay. So there are two systems in fact are involved. So what can you expect? So the answer of this is, so let us just go one by one. See, if it would have been spinal muscular atrophy, they must have given you something related to the muscles. Okay. If it would have been GBS, they must have given you something like ascending paralysis. Okay. So these are the things which would have been enlisted. But now this is not the history. Botulism is of course something that is responsible for CNS infections, also responsible for your GIT infections also. Okay. And since the CNS infection is there, the diaphragm is also not going to function very properly, and that is why there can be involvement of respiratory system as well. Okay, there will be involvement of respiratory system as well. And next is the viral encephalitis. That is also an issue. Viral encephalitis is only going to have a CNS problem. So the correct answer to this question is infant botulism, and infant botulism is actually the topic for today. Now, botulism, if we see, has been divided into three parts. One is called as wound botulism, the foodborne botulism, and the infant botulism. So infant botulism means what? See, infant botulism is actually produced from ingestion of the spores. Okay, from ingestion of the spores. Okay, then of course, this is in children, in infants. In contrast to this, adults, they don't germinate the spores, but they ingest the toxin itself. So this is something you have to understand, that infant toxin means that they are going to ingest the spore, and the spore is going to get multiplied, germinate, and then it is responsible for release of toxins. But adults themselves are toxic. So adults, they don't germinate the spores, they are going to ingest the toxin itself. Okay. So what is going to happen in infant botulism? I have told you it is going to involve the CNS and GIT. So there will be decreased frequency or even absence of defecation. So the first sign is that, the first sign is no second number. Okay, so I don't know if it is called in foreign countries also, but in India we say one number is urine, second number is stools. So the first sign is actually the absence of the second number, that is defecation. So parents actually typically say that all the CNS manifestations like inability to feed, lethargy, cry is not good. Okay, so in all these cases this is going to happen. And what happens is that the muscles are weak. Okay, muscles are going to be weak. Okay, because that's involving CNS, the nerves are not stimulating the muscles, so muscles are weak. That's why there will be dysphagia. Okay, why there will be dysphagia? The patient is not able to perform the gag reflex, suck reflex properly, so that's why the child is not able to eat the things properly. Okay, and of course the corneal reflexes are also diminished, because botulism is something which is going to involve your central nervous system. Okay, that is the botulism. So botulism has something to do with GABA. Okay, that's a inhibitory hormone. Okay, then it has something to do with acetylcholine also. So mainly actually it is related with acetylcholine also. So there is deficiency of acetylcholine in botulism, right? And yes, there is a loss of head control also. That's a prominent sign. Why? Because the brain is not functioning properly. Okay, then emergency. What is the emergency? Respiratory arrest. Okay, so respiratory arrest is something that is a huge problem seen in these patients. Why? Because it may occur suddenly from airway occlusion by the unswallowed secretions, or it can occur because of the obstructed flaccid pharyngeal musculature. So either the pharynx is not proper, or there is occlusion. Okay, or there is occlusion by the unswallowed food items. So how will you diagnose? Okay, how will you diagnose this? See, very simple: presence of botulinum toxin in the serum of Clostridium botulinum. Okay, serum, or it can be in the wound material, it can be in the enema fluid or feces, anywhere it can be there. and we give the BIG, botulinum immunoglobulins, okay, has to be injected intravenously. BIG is botulinum immune globulins, that is given, okay, so that is given for the treatment, right? So after that you have got the foodborne botulism. So foodborne botulism is that when the preformed botulinum toxin is contained in, some containers have got some of the toxins. So if there are foodborne means that in the food there are already the toxins have been produced, like toxin type A, B and EF. Okay, A, B and EF are responsible for causing this. Okay, so first sign in actually both of them. Okay, what is wound botulism? Again, this requires the germination, and Clostridium botulinum is going to have those spores. So spores are going to go. Okay, so initially in foodborne as well as wound infections, the features are more or less very similar. So clinical features in the older children, when it is a foodborne problem, foodborne issue, so there will be diplopia, there will be dry mouth, there will be dysphagia, there is dysphonia, there is dysarthria, there is decreased gag reflex, decreased corneal reflex. Okay, so all these things you have to remember. Okay, so diplopia, dysarthria, dysphonia, right? Diplopia means ophthal, eyes. Dysphagia means ENT. Dysphonia means ENT. Dysarthria means I don't know who, because rheumat people say it's my patient, ortho people say it's my patient, general medicine people say it's my patient. Nowadays, Ayurveda, physiotherapy, everybody says it's my patient. So dysarthria, I don't know. But anyways, just a way to remember that. Okay. After that, foodborne infections. Yes, I have told you that, okay, these things we have discussed. Yeah, but vomiting and diarrhea, these are important. Vomiting and diarrhea. So coming for the question of the day, now you people will tell me in the comment section. Like for example, there can be a Bacillus infection, like Bacillus cereus is going to have the infection. Clostridium botulinum can have the infection with the food. Staph aureus can have the infection with the food. Now how will you differentiate? Okay, how will you differentiate their infection? Okay, how will you differentiate the infections on the basis of symptom? Okay, on the basis of symptoms. So then coming on to what? Then coming on to wound botulism. So I've told you, see, the things are actually very similar. Dry mouth, ptosis, diplopia, dysphagia, dysphonia, dysarthria, decreased gag, corneal reflexes, everything are going to be similar. Okay, so can you see, this is a normal baby, this is a floppy baby. Okay, and floppy baby is caused by what? Clostridium botulinum. I don't know if there is a tradition in your town or not, but when we used to be young, in fact till now also, like 15-16 years ago, when my sister was born, so then also we had this tradition in our family. We used to give honey to the baby. We call it as chatti in our families. So just to let you know that honey is a very dangerous substance, because it has got spores of Clostridium botulinum. So it is highly advisable by all the doctors nowadays that please abandon this. Okay, and in talking on the same notes, in some villages of India, there's a tradition that they'll apply cow dung at the umbilical area. Okay, so this is also having the same issue. So that's why as a doctor, it's your responsibility to keep the general public, the general population aware of this. So thank you so much for joining for this session, and I hope that you are well versed now with the topic of Clostridium botulinum infection. Thank you.